Good evening, everybody. This is Dr. Ziv Simon. I'm here with my friend and my partner, Dr. Ari Rosenblatt. We're excited to have you in our patient webinar that we're going to dedicate to how to live a normal pandemic life and talk about some precautions, tips, and tests that we feel a lot of people need to know. There's a lot of confusion out there. There's a lot of misinformation. And bottom line is we want everybody to be safe. So we decided to have this webinar again and have more information brought to you so we can share things, a couple of things just for everybody to know in case you get disconnected. Go back to the original link. It's possible. Technical problems happen. Hi, Ari. How are you?
I'm doing great. Happy to reconnect with our patients and looking forward.
Thank you, Ari. So we are excited to have everybody here in this webinar. Welcome to this training. We're going to have a Q&A session at the end of the webinar. We're going to go about 45 minutes. We're going to keep it short and concise and hopefully very clear so you can get the information that you need. Hopefully it's going to be valuable to you and things that will keep you safe at the time of the pandemic. It so happens that the pandemic, Ari, is not over from what I can hear.
Yeah, unfortunately, just in today's front page of the LA Times, it has been reported that in the last 2 weeks, the incident of COVID diagnosis has been going up dramatically, 30% in the whole county and 40% in the LA area. This increase may be due to the lessening of all COVID restrictions. And I think what's happening now is, as expected, there's going to be a new wave of the more infectious variants. And the same thing is happening, as I read in the papers today, also in New York. So unfortunately, we still have to be vigilant. And hopefully today's discussion will make everybody a little bit more smarter and be aware of what is helpful and what we can do about it.
Thank you, Ari. And we've had 3 previous webinars over the past 2 years where we gave you the updates as they became available to us. We've been practicing at the time of the pandemic right from the beginning. We gained a lot of experience that we are now implementing in our practice and also in our personal lives. We're doing simple things can keep you protected because, like Ari said, the pandemic is not over. The people are more lax, people making up for lost time, but we certainly need to be protected. And if you're interested in watching our previous webinars, you can go to ddscorona.com and simple to watch. We were very busy in the past 5 months. We have expanded our office and remodeled it. It was a very exciting task for us, a very exciting thing to do for the ones of you that visited us in the past few months. Hey, the office looks completely different. It's larger, the colors are different. We no longer have carpets. We got rid of a lot of things. And we wanted to share with you what's new. The nice thing about how Ari and I managed this construction is that we never closed. We were fully functional throughout this time since last, when was it? I think we started in November or October. That was when we expanded. And we worked after hours. We worked on the weekends. It took a little bit longer. It cost a little bit more to do this way, but this was one of our conditions with working with our contractor, that we need to stay functional. We have a lot of patients under care that need the treatment, that cannot be interrupted. And thank you for all the patients that were very understanding. I'd like to say I truly appreciate everybody's patience throughout this process. All right, this is the let's call it the old office. It was a bit heartbreaking for me on a personal level after being with you and in this office for close to 20 years to demolish. And honestly, when you handed me this hammer and I demolished the front desk, I had tears in my eyes. It was very hard to to do that, because this office means so much to me. It really is a great part of my life. But I think you did a great job here. Take a look.
It was actually tough to demolish certain things, and it was very emotional. But like everybody knows, the beginning is always starting at the end, and we are both so excited to have a new facility that will serve us, our staff, and most important, our patients so much better.
Yeah, so exactly. And what we had in mind is to create an office that will put our patients and team at ease. We actually chose a designer that is coming from the hospitality industry, from designing hotels and restaurants and spas, so we can instill the same type of atmosphere in our office. And we actually, Ari, we actually found the original plans. My daughters looked through everything else, and we found the original plans in the office. What we decided to do is to keep the exact same layout of the office. It was, Ari, I have to say, it was brilliantly done. Looking into the future to build this office in a certain way. Can you share a little bit about why the office, or how the office was designed in a certain way with all those 7 operatories, and what was different between doing it today and doing it in the 90s?
Well, at first, I always had the big dream when I designed the office that the office needed to accommodate myself and a future partner that I did not have at this particular time. So I was building it in mind with the dream coming true that I found you as a good partner. So I built it exactly to the desire that eventually 2 people, 2 doctors with a greater staff than I started out with. So I designed it with that in mind. But certainly the flow of the office was more people working in the office with new hygiene requirement. And most important, we couldn't accommodate in the last couple of years the latest technology. We had to, unfortunately, refer patients out of the office for certain procedure and for certain diagnostic procedure. And by having more space next door, we finally could expand and not only renovate the office, but add valuable technology and more space and more privacy for our patients as well as our staff. So I'm very excited at this particular stage to continue working here. Even so, I'm already over 40 years in this practice, but it gives me the belief and motivation to continue working together with you, Ziv.
Thank you, Art. Thank you for saying that. It was a great experience to take the office, the pre-existing office that has been serving the community for about 40 years, and take it from planning to execution. And here you see the contrast between the old and the new. We kept it actually very simple. That was one of our criteria in our instructions to our designer and a contractor. Don't do it over the top. Make it simple, pleasant, classy, and high tech, because this is really what we are all about, the quality of the work and the care. And when you walk into the office, you'll obviously see the change in the waiting room. You can still sit. We still use the exact same COVID precautions. We now built an operating room. This used to be actually a private office. We've vacated it, we demoed it, and now we have an operating room with 3 big windows that we're going to do our advanced surgeries in. And then everybody knows the hallway. The hallway is now extended even more into the new space. This is now our technology center. We now have a CT scan. We have optical scanning. For some time, this is where we do our virtual surgeries. And we do something very exciting called 3D printing. What is 3D printing? We take a design in a computer, a virtual object of any sort. In our case, we're doing guided implant surgeries. We plan it on the computer, and then through this device, we can print physical objects and physical guides that help us place our implants in a very precise and accurate and more than anything safe way for our patients. By the way, we've been using this technology for a long time. I would like to say at least 10 years, but we always sourced it out. Here's our waiting room. I'll give you a little walkthrough. This is our front desk, fully redone. And here's our very well-known long hallway with the 7 operatories that you've seen before. All of the operatories were redone, including a new laboratory for sterilization. This is our new operating room. It's almost done. You can see it's about a couple weeks away from finishing. I feel like we can almost play bowling here in the morning. We certainly get our steps in every day because we do a lot of walking in the office. And we designed it in such a way that it's not going to be a shock for people coming in, but it's going to be just the same office, just an improved version. This is the technology center. This is our new office from where we're doing the broadcasting right now, our CT scanner, our 3D printers, ready to print computer guides. And it's just great fun to be in the office. Why did we do that? A lot of people ask us, you guys were already leading practice in the community. You've been here for 40 years. I've been 20 years with Ari. Why did you do this? Well, we wanted to have an in-house everything if we could. We already had our in-house COVID protection center from the beginning of the pandemic. But we also wanted to have the in-house technologies like CT scanning, optical scanning, 3D printing. And instead of sending you to another radiologist, which worked really well for all these years, we can now have it in-house because we have better control over the product. We have faster delivery. We have the convenience factor. And more than anything, we have a bigger and better space for growth. So the answer is, why did we do this? Because really we needed to grow, because what doesn't grow dies. That's the law of nature. Whether it's your mindset or your knowledge or your bank account, if it doesn't grow, it's going to shrink back. And in order to be a great option for patients and else, we needed to grow and expand, and we also enjoy the process. Now, going back to the pandemic made us all grow. All of us, we're now 2+ years into the pandemic. Yes, there's still COVID out there. Yes, we don't see as many masked people, but the COVID is there, and it's the numbers are on the rise. People are going to malls and to restaurants, and it's a great thing. We are making up for lost time. Why not? It's great, but we might as well be protected in the process and make good choices, because nobody wants to get COVID, even if you're vaccinated. We're going to talk about those precautions and what's a breakthrough infection, etc. But really, Ari, what we're looking at here is a new normal. How do we live in this new normal? What do we need to do? How do we live a normal pandemic life? By making good decisions and starting with masking. Let's not throw away the mask. Let's always have a mask available to you. Yes, you can go to Disneyland and they don't require you to wear masks. It would be crazy to go in a closed space with hundreds of people that you don't know and potentially contract COVID. You're going to have a really magical experience laying in bed with 102 fever after visiting Disneyland. So let's be smart about things. Let's not be lax or too cavalier about how to handle the pandemic at the moment when things are opening up or already opened up. There's still a mask mandate, and there are certain areas where you have to wear a mask because it's mandated. For example, healthcare setting, like our practice. We're in healthcare. Dentistry is part of healthcare. In our practice, we haven't changed any of the protocols. We still wear our respirators, our N95, our P100s. We're still doing the surgeries under the highest precautions. When you walk in, you'll see all of our team members, whether it's the front desk or the assistants here, they're working here in the technology center. We're all masked because our office is a masked environment, and we apply the same screening protocols for you because we want you to be protected. We want all of our patients to be protected, and we want ourselves to be protected as well, including our staff, because we love practicing. And if we go out with COVID, it's not only a financial hardship for us doctors, practicing doctors, it's hardship for the patients, because once we are out of commission, we have to cancel all of our surgeries. We have to postpone all of our surgeries. Thank God it didn't happen. So we want to make sure that everybody's healthy. So we take temperatures. We have this great device in the front, right in the waiting room, where it takes your temperature, plus it gives you a spritz of sanitizer as well, so you can sanitize your hand. It's a great device. If you have a business and you want to have that, it's a great thing that you can order. And if you don't have a mask, naturally we'll provide it to you, so you have it. So again, for all the patients in our practice, thank you so much for helping us keep all of us safe, our team and the doctors ourselves. We care about our health. Otherwise, we wouldn't be running these webinars, and we want you to be safe and healthy and still enjoy life. And I feel like, Ari, this is very important, not to live in fear. Make the right decisions and still live. I mean, Ari, did you go back to normal life?
Certainly not to normal life. Certain things have certainly changed from 2 years ago, where we knew very little about how to protect ourselves. But I think this seminar and our philosophy applies to people who are not paranoid, but applies to people who are different than, I think, some population that is basically either fatalistic and say it's going to happen, whatever is going to happen, and we don't want to think about it anymore. But I think if you apply common sense and take some of the precautions that we recommend, you can live a very productive and fun life, and you don't need to be paranoid about it.
Thank you. Thank you. So, although masks are not mandated in airplanes and indoor public settings and businesses like retail, restaurants, it's still recommended. I mean, we can't eat with a mask on. So we're going to talk about, common sense decisions we can make. But listen to those recommendations, because the numbers go up, and there's really no downside to wearing a mask indoors. For example, if you are contemplating which mask to use, should you use a surgical, a cloth mask, or a respirator? Well, let's start with a cloth mask. We don't recommend you use them. You'll have to wash them. You'll have to sanitize them. It's so much easier to use things that are disposable. Maybe not the best for the environment, but don't forget that the washing machine is also not the great thing for the environment as well. We don't wear cloth masks, so either a surgical mask or a respirator, like an N95. But if you want to have a nicer N95 that not necessarily matches your outfit, but just looks a little bit more friendly, not so medical, we discovered this company called Mask C. These masks are a little bit on the costly side, but they're very nice. They're N95s. They have kid size as well, and they come in different colors and patterns, and they're just great. We use them a lot at home, and it's fun to choose those masks from. And when you go to a restaurant, well, you're not going to eat with your mask on, but great choices are to eat outdoors. Why not? There's so many places where you can eat outdoors. Actually, nicer to sit outside, and we live in a beautiful place with beautiful weather typically, and be very selective. For example, for my own family, we're very strict on COVID protection. We've got 6 family members. So if one goes out, everybody else is at risk. We don't want that. So we sit usually outside in a distant table. If a place is very, very busy, we just don't go there. And we when we're done with our meal, if we have to go to the restroom inside, we're going to put our mask on, and our kids are very, very well trained. trained. Indoors, yeah, surgical and respirators, the KN95 or the N95 are great choices. It's not like it used to be a year ago, 2 years ago. It was very hard to get. Nowadays, it's very simple to get on even Amazon. We use obviously our medical supplier. There's still a world shortage, but honestly, it's not a big deal. We can get those masks anytime. So when I go to the bank, I put my mask on, even if I'm not mandated to do it. If we go into a store, I don't see the downside wearing a mask. And definitely, if you're going into healthcare, like a medical building, like our building, which is, by the way, being remodeled as well, the whole building. You go into a medical building is a building with sick people, right? Where there are physicians, there are people getting COVID tested or treated for COVID. I'm not saying, it's not an urgent care, but we do have urgent care doctors in the building. Keep your mask on. And when you get to the office and when you get to your actual treatment, then we'll instruct you when to take the mask off when it's safe and you've seen already all the precautions that we are taking in the office. So the key in small spaces, we talked a lot about surface decontamination and sanitization of your hands. And that's still important. It's still key. But the key now is the air. Not so much about Clorox wipes and where to get them in bulk. Right, Ari? You were so resourceful in finding Lysol wipes and Clorox wipes. We ordered boxes for the office and for our personal homes. So what has changed?
I think what changed is that in the beginning, again, we were clueless, where the virus is hiding. And so we scrambled on the internet to find all surface cleanings and stocked up on them. Not to stock up only because, we have a big turnover in the office and we wanted to make sure that we are protected. But as you said, today, everything is about the air and ventilation. And that's why in the office, we are now concentrating more about cleaning the air. And we will share with you now in regard of what kind of equipment we are using in our facility to clean the air and clean the environment, because we know the virus is in the air.
Thank you, Ari. And really, the basic option to get great air is, guys, open the window. The window is your best friend, and this is our new operating room, the new operation room. We have 3 big windows. They can be opened for just fresh Beverly Hills air as best as possible. Like all the other operatories, you can simply open up the window, and if you're going to a doctor's office, hopefully the windows are open, and they can be opened upon request. This is my personal desk here, a bit of a mess, but I have a fresh air coming in. And for the air that is already inside, air purifiers are very important for closed spaces, whether they're retail or medical offices or your own private home. Get your air purifiers. I mean, in the past, we looked only for IQ Air, and they're great. They're great. They have 0 problems. They have no issues at all. But you can venture into different other air purifiers. I counted about 17 in our office alone. We are a team of now 17 people. So we almost have 1 purifier per person. In every space, this is our technology center. This is the air purifier inside. This is one of our operatories. Ari, do we have to get IQ Air in your opinion? Are there any other air purifiers that you would recommend?
I think the most important principle is to have air purifiers that have been shown that they are cleaning up to a certain size, ideally 0.003 microns, which is the size of any virus. And we have had great experience since the air purifiers in our office, including in my home and your home, Ziv, are running the whole day. And we are not endorsing any products, but the IQ Air has been working now since the beginning of COVID in our office and in my home. And there was not one incident of any either malfunction. And once you spend a certain amount of money on a good product, either the IQ Air or the molecule, it pays for itself because the incidental cost of air filters or whatever are so little. The IQ Airs are running in our office literally 24 hours. And from the multiple units that we have, we had to replace, I think, only once on certain IQ Airs, one filter, and the other ones are still working with a certain indicator light. I think the most important thing is to have the principle that you're buying something for quality, that you're not buying a product where 3 months later you can't find any replacement parts and filters. And I think the other most important thing is that if you're buying an air purifier, that you have the ability to remove a filter to either clean it itself or replace it with another filter, because you don't want to accumulate whatever you suck up in the air and don't know where it ends up in your filter. So the only thing that I would encourage people to have ventilation and the air filters, because even if hopefully COVID is over, what I found out that having it at home and the office, the incidence of flus and other viruses was so much less. And what happens, especially with the air in LA, the incidence of allergies has also been dramatically reduced. So there's a benefit all over for many other reasons besides COVID to clean up the environment surrounding you.
Thank you. And like anything in life, you get what you paid for. So you get a high quality product and it's not going to break as much and it's going to do a better job. And so the IQ Air, zero problems. Same with the molecule that we're using. And then we actually sign up for a subscription where they send us new filters every 3 or 4 months. So, it's important to maintain those filters so they keep working. Now, dentistry is all about aerosols. Whether you're working with your general dentist or getting a cleaning or having a procedure done with us, the aerosol gets emitted from the procedure. And of course, it's important to have that aerosol captured by aerosol suction machines. We have 3 of those for every procedure, and they're a bit noisy. But inside the machine, there is another filter, HEPA filter, that captures everything and kills everything inside. So that's a great thing. One thing that people don't think about is the air conditioning system. What do you know what's there? When was the last time you changed the filters at home or at work? Well, we're now learning through this pandemic that there are different standards for filters, and it's just a matter of choosing a better filter for your air conditioning system. And we chose a filter called the MERV 13 for our air conditioning system here in the office, simply doing research, which is equivalent to the same filter that operating rooms in hospitals have. So we want to really have the highest standard because we believe that more than surfaces, more than screening, it's really about the air that you're breathing. And through opening windows and using HEPA filters and air conditioning filters and aerosol suctioning devices, all of that will make the air much healthier, a bit drier, but much healthier for you to explore and to breathe in, especially in a dental environment. Now, is the pandemic over? We see a lot of patients. We meet patients in the streets of Beverly Hills. We live inside our community here. Ari, it's not over yet.
I don't think it's over. And again, there's a certain percentage of population who either want it to be over or just fatalistic and are not caring anymore about precaution. But as we shared with you in the news, COVID is coming in waves. And you can see on the graph that unfortunately, just in the last 2 weeks, the numbers are going up again. And again, the good news about it is that everybody who has been vaccinated, everybody, we'll talk about boosters who has been boosted, if they, God forbid, do get a form of COVID, the experience has been shown that the illness will be much milder and will be much easier. And fortunately, the numbers of hospitalization is not going up dramatically, including the complications in the hospitals. So it's good news and bad news, and therefore we wanted to share how we can protect ourselves even further.
Yeah, so we want to make sure that we are obviously vaccinated. I don't believe in mask shaming or vaccine shaming at all. Everybody should do what's in their best interest after being well informed and talking to their physician. But just to repeat, the vaccine basically teaches our cells to make the spike protein similar to the COVID virus, those spikes that are so famous now. The immune system does the rest, and it creates antibodies aimed against the spike protein. This is how the vaccine is working, the mRNA, and we have those antibodies. I wouldn't say 100% protective, but you'll be more protective and you'll have a less disease severity. And we've gone through the first injection and the second injection, and we have those circulating antibodies, some more than others. It's hard to measure that, like Ari will talk about that. But over time, the number of antibodies is going to go down. And then we get boosted. We are getting another form of the vaccine that is called a booster. And that booster will again increase the level of antibodies in our system. And to me, Ari, it was a bit confusing, and we talked about it quite a bit, throughout the past year. Can you check on antibodies? Can you know the level of immunity that you have? Are there any tests we need to take to check on that?
The problem is that there are different, not one, but there are multiple tests that are available today to check on antibodies. The problem is that there has been scientifically no particular number that has been established in order to show definitively that a certain numbers of antibodies protect you for any infections. So therefore, for example, people who have been vaccinated and boosted still can get breakthrough infections, which proves the point that antibodies don't protect you totally. So when we reviewed all the scientific articles, basically the summary is that the antibody testing is still a flawed science. There is really no definitive test or number to give you the assurance that you can walk around believing that you are protected. Therefore, also, there is no official government immunity passport, because there is really no definitive test to show that you are so-called immune. So basically, everybody has to apply some common sense, speak with their physician, and find out if they have been vaccinated with the normal first and second shot and is considering either the first or the second booster. They have to basically consult with their physician and determine, do they fit in the group that they're over 60 now, over 50 years old? Do they have some immunity problem? Do they have some underlying disease that justifies to adhere to a schedule of a third and fourth booster? I know some people, when I talk to patients, they say, maybe we should wait. The new booster will include the new variants. I've done a lot of research and spoken to scientists. Unfortunately, the new so-called booster that will include the new variants will not be available until the fall. So that's a long time to rely on the antibodies that are waning from your first, second, or third booster. So everybody should get themselves educated, and I think speak to their physician and see in which group they are falling in. And I can tell you only that, in our staff and Ziv and myself, we got the first and second shot. We got the third booster. I got myself the fourth booster, and I said Ziv is very soon getting his fourth booster, only because We are exposed to the public. We see a lot of patient in close contact. We want to protect ourselves, but inadvertently also our patients and our family. So we are going with the science that we need to be holier than thou and just stick to the recommendations that have been proven over time to protect ourselves, and knock on wood, we both are healthy, the same for our staff, and we must have done something right over the last 2.5 years.
Thank you, Ari. That was brilliant. So it is confusing. You get to the point. There's so many injections out there. There's, dose 1, dose 2, boosters. It's a bit confusing. That's why we included this part in our webinar today. So booster number 1 really is for anybody over 12 years old. Okay, I know my kids were boosted. Even the younger ones were boosted in a smaller dose. But booster number 2, you got to be 50 years old. So I just hit 50, and I'm going to get my booster. That's the 4th injection. And it's also approved for people that are immunocompromised with immune problems, or the ones that took the Johnson & Johnson vaccine, which was obviously not a great success and had some very significant side effects with blood clots. So the question is, when should I wait? Okay, I'm ready for my 4th injection. Is there maybe a guidance, Ari, that you and I can give our patients? And of course, we want to preface that we are not physicians, and we cannot tell you, and we cannot give you medical advice, obviously. But we've been in this in the pandemic for a very long time as practicing clinicians, and we are part of the medical community. Is there some clarity that we can create for our patients? When is a circumstance where they should wait? When can we hold off?
I think, again, this is all coming to a personal level. Your relationship with your MD. Are you somebody that has to go to work, has to be in an environment, seeing a lot of people in closed environments? Are you more working out of the house and not exposed to the public? Are you traveling? Are there any underlying health issues like diabetes, high blood pressure, age-related issues? I think that we just have to be educated and not put our head in the sand and ask the right questions to ourselves, get educated, and have good advice from your MD. And hopefully the little bit of information that we are giving you will make you more educated about it.
Perfect. So here are the circumstances where you may want to hold off on booster number 2. If you had COVID in the past 3 months, you have antibodies. You are more protected now, even probably better than a booster. So the COVID was technically your booster. If you're thinking that maybe if you take the booster now, maybe you won't take it later, Ari alluded to it, and there are pros and cons. But if a booster may be more important in the fall, question is, if depending on your daily activities and your line of work, it may include a better protection against the different variants. But if you decide to get boosted in the last booster, you want to wait at least 4 months from the previous booster. It's only for Moderna and Pfizer, so you must remember that. You don't need to present any documentation for being immunocompromised or anything like that. You naturally need to show your ID anytime you get a vaccine or a booster. And we re-emphasize that this is a decision between you and your physician, your MD. Just to be safe, you may have specific medical circumstances or specific medications that maybe you don't need to have a booster. I've spoken to hundreds of patients about the vaccine and the boosted side effects, and I did see patients with side effects, especially the ones that have inflammatory conditions, immune conditions, where they're getting the immune system challenged did create some negative side effects, actually worsened arthritis, etc. But please speak to your physician about this type of problem. And another question that is commonly asked Can we get COVID even when vaccinated? I think most of us know the answer for that. Yes, absolutely. You can. It's not a protection. It's not a guarantee for protection that everybody should be aware of. So don't be lax about it. And there's a name for that: the vaccine breakthrough infection. It's when an infection happens when one is fully vaccinated, and that happens as well. Maybe more with the different variants that we're seeing now. We're not going to get too much into the science of the variants, but the variants across the board, except for having a cool name, they are causing more serious disease. They're more infectious. That means that there's more viral particles in each aerosol that it gets spread around. So they're more, let's call them contagious. They're more likely to cause severe disease, even death and hospitalization. And there are more variants coming in, and we're expecting more and more to come, which is the nature of the virus. It tends to mutate, and usually it mutates not in our favor. It actually is worse for us. But I feel we got some good news here. If you know how to protect yourself from the original COVID virus, you will be able to protect yourself from the variants. The protection is the same. Yes, it's more infectious in exposure. However, if you're protected with the conventional protection methods that we have been recommending for now over 2 years, you'll be protected from the variants as well. And I think, Ari, this is just a great, kind of for me, it's a peace of mind. If I was able to stay healthy for 2+ years, I'm not going to worry about the variants because I'm going to protect myself just the same way.
Correct. And we basically are sticking to the same regimen as we have established in the beginning of the COVID crisis. And we will share with you again our summary of what vitamins and supplements we are taking. Again, this is all based on individual preferences and consultation with your MD. But we will shortly share with you what we have done for the last 2.5 years, what our families have done, what our staff has done. And again, knock on wood, this has prevented any illnesses surrounding us.
Thank you. So what do you do if you get COVID? It's kind of stressful, and I haven't gotten COVID, but it would be very stressful to get the news of feel ill and then think about reinventing the wheel. So we're going to provide you now with a step-by-step protocol of what to do exactly if you get COVID, if you get ill all of a sudden, and a lot of us will get ill. So these are the immediate steps you need to take. Number one, stay home and isolate immediately. Cancel all your plans, your dinner plans, your all the travel plans, etc. Stay home and isolate, rest, hydrate, give your body the best chance to heal. If possible, take your temperature, take your oxygen. It's great to have a thermometer at home. It's great to have a pulse oximeter at home. You can get them anywhere. The easiest is Amazon. Just get them on Amazon. They're very, very inexpensive. They are sold not just to medical facilities or doctors. You can buy them, and you can measure your temperature. You can measure the level of oxygen. Naturally, the temperature is a factor in COVID illness, and the oxygen saturation, which is basically the level of oxygen in your blood, it's going to reflect your breathing. And we know COVID affects breathing capability. If you have fever, if you have pains and aches, don't take Advil, take Tylenol. Make sure to tell your close contacts. It's not an STD. We're working as a society to protect one another. Tell all the people you've been in touch with that you are possibly with COVID, or you were diagnosed with COVID, you have symptoms, so they can take the necessary precautions for themselves. If you have an iPhone, very often you're going to get alerts. It's called contact tracing. It's a feature of the iPhone. It's kind of crazy. If you stood next to somebody who has COVID and they declared this on their iPhone, you're going to get an announcement. But if you stay protected, you have nothing to worry about. Another immediate step at home: open up the windows, increase airflow, ventilation, avoid cross-contamination in your home. Make sure you stay away from your partner, your kids, your other family members, and even your pets. I know it's hard. It's stay away from them because you don't want to cross-contaminate. Put the purifier next to you on high, maximum 100%, and get tested. Use a rapid test first. We recommend you have one at home. If positive, if it's positive, it's positive. You don't need to get a PCR, which is the more accurate test. This is the test that is very simple to get at Rite Aid and CVS. We like to order them from Amazon in big quantities. We like to have them in the office, at home, just in case. Also for social events, just to have them available. So if you decided to have a gathering and you decided to have see more people that are like you, responsible, you can have everybody tested. Each kit comes with 2. It's a very simple kit to use. You test, and within 15 minutes you get the answer. You don't want to be on the T, you want to be on the C. So it's
Ziv, if I can just interject. Previously, a year or 2 years ago, and I think even 4 or 5 months ago, those tests were in very scarce supply and very difficult to get. They are now so ubiquitous. You can get them anywhere. They're inexpensive, and we literally give every staff member a few of those at home, that when in doubt, they test themselves if they feel even an inkling of being sick or whatever. The only thing that I would just emphasize for those people who agree about the importance of immediate testing themselves, it's pretty obvious that when one doesn't feel well, if one has a slight temperature, if one has a cough, if one has the sniffles, that doesn't mean that they have COVID. They can have the garden variety allergies. They can have the garden variety small flu. And how do we know about this? So I think the only difference today, and that is our recommendation, is that we don't want you to be paranoid, but treat it as if it could be potential COVID. So if you have the sniffle, if you have any kind of signs of the flu, assume it might be and isolate yourself until the COVID test confirms that it's not COVID. And the only problem with it is that the definitive test is the PCR test. But sometimes you feel like you want to isolate yourself, you don't want to expose yourself to the public, and you don't want to go outside to take the PCR test. So what I have heard a lot from people who were diagnosed with COVID, sometimes those self-tests will take a day or 2 or 3 to show that you are positive. So the moral lesson for me is, if you feel a little bit sick, it may not be COVID, but still isolate yourself for the sake of yourself and the surrounding family members and the society. And be aware that this self-test may not immediately show you that you have COVID. So either wait for your symptoms to subside, which basically means that if after a second, third, or fourth day you are feeling better and the test showed that you are negative, you had the flu or you had a bad case of allergies. But please don't rely only on the 15-minute COVID test to say that you don't have COVID, because you don't know it until the second or third day, because it depends on the viral load. So that's the only precaution that I wanted to share.
Very good point, Ari. Very good point. And yeah, I mean, within the limitations of a rapid test, in the absence of symptoms, if you have symptoms, it doesn't matter if your COVID test or even a PCR test is negative. Don't expose yourself to others, your family members, friends, or just strangers, because you will infect them. And here are my kids with their friends, all smiley, so happy to have dinner with their friends. You can also get free COVID tests from the government. Here's the website. I think they send you about 8 totals, 2 sets of 4 tests. You go in there, put in your name, at home, at work, and you'll get those mailed to you, and they're very good. So it's great to have a bunch of COVID tests at home available with you. So you never know. You just want to have it. Maybe even a friend needs them, and you'll be acting as a good friend and being a source of help for other people. Now,
the only thing I would add is that if somebody puts their address, just as a little tip, don't put your business address. Actually, the government was very smart about this. They are not going to send it to your business. The postal office will send it to you only to your home address. So don't put any business address.
Okay, thank you for correcting me. That's why it never arrived to the office, I guess. Okay, so moving towards proper healing, it is recommended to contact your healthcare provider, your physician, to determine if you're eligible for treatment. Naturally, the vitamins and the supplements that Ari will review. We talked about, ventilation. There are two medications. Ari, if you would talk to us briefly and explain, how do we get those medications? Do we just buy them? Are they over the counter?
I think the good news compared to a year or 2 years ago, where unfortunately people got sick and had to go and be admitted to the hospital, if your symptoms are severe enough, short breath, high fever, now we have available two kind of antiviral medication. One is by prescription tablets that you are taking, that if you are taking them early enough at the onset of COVID, they dramatically reduce the side effect, and that's the Paxlovid. You do need a prescription from your physician, or have the certain CVS or other big pharmacies that have certain centers that will supply this. And for the more advanced or severe cases, there is antiviral injections, IV infusions that will drastically reduce the side effects of COVID. And again, before, years ago, we needed to be admitted to the hospitals. Only few hospitals had it. Today, physicians can refer you to infusion centers. Those medications are getting every day more available, and they are cutting the time and the severity of the infection drastically down. So be aware about it and be an educated consumer that depending on your system, ask your physician, get the help. And not everybody needs this. Some people are jumping the gun and doing it after the first day, which, again, in my opinion, after speaking to physicians, there is some benefit that if somebody is unfortunate to contract COVID and doesn't have any big side effects, your immunity will be drastically improved if your own antibodies are being produced instead of being infused. But be aware about those options. And again, the good news is they are available today, and they were not available last year.
Thank you. So that's brilliant. So there are a lot of options when you happen to contract COVID, and the chances are that we will all at some point contract COVID. It's just a reality. It's a statistical fact. So we need to stay protected, not just actively, but also protect our immune system and, cherish this beautiful body that we got. We just got it. This beautiful machine that has a built-in immune system that is protecting us. And this is our number one line of defense. And for that, we can use various vitamins and supplements.
So the only thing that we are reviewing, because we have spoken about this at multiple previous Zoom seminars, most MDs will agree that most people are actually deficient on vitamin D, and most physician and scientific articles will agree that vitamin D, vitamin C, and especially zinc are beneficial for general health, but especially also for immunity and prevention of inflammation. So Everything is about the antiviral capabilities to expedite health and prevent inflammation. So we strongly recommend, and again, we are preaching only what we are doing, is to be on the appropriate vitamin D, zinc, and NSC. I personally am a little bit of a vitamin freak, and I would rather take one more vitamin than be deficient. So I take every day before COVID, and now during COVID, I'm taking a higher dose of quercetin. And Sambuca has been shown in many anecdotal scientific studies to reduce symptoms of cold, sore throats, and again, increase the antiviral capability for your body. Elderberries lozenges have been shown also to be very, very beneficial. So everybody can do their own research. You don't have to take 20 vitamins. Agree with your physician or your own research what to take. Everybody knows that this particular compound, which is like similar to green tea, is good for general health, but again has been shown to increase the levels of immunity and inflammation prevention. So Ziv and myself, including our staff, have all those vitamins available for our staff, and we all take them. Every day, new studies are coming out, some accidentally, some because the relationship has been shown very strongly that, for example, just recently in the scientific literature, a certain antidepressant, fluvoxamine, that has been taken by people who have needed that antidepressant medication reduces drastically people who contact COVID and reduces the mortality. So I think the nice thing about that, for example, people, including myself, who have trouble falling asleep and taking melatonin, have been shown to have a lesser incident of COVID infection. So I don't like taking sleeping pills or whatever. And if I know that melatonin helps me to fall asleep easier without any side effect, it has been shown across the board that people who are taking melatonin have a lesser incident of COVID infection. So again, I am just including it in my armament, and it just works for us. So we just wanted to share this review that we have shown already previously. A lot of people are asking us, is there any particular mouthwash that is antiviral? Actually, there were very few mouthwashes that were not only antibacterial, but also antiviral. One of the medication that some of you have been given by us was called Peridex. It's chlorhexidine. It was a very good antibacterial and antiviral medication, but the problem with it is it tasted terrible, and it also was staining your teeth. Just a new company in Florida by scientists have discovered the old benefit of iodine that has been reformulated, that it doesn't stain. Iorins was available in the beginning only to professionals. Now you can Google it and buy it from the consumer division of this Iorins outfit that sells it. And the beauty of it is that it tastes much better than the previous medication. It's great against inflammation and bleeding gums, and we give it to patients after certain procedures of surgeries. For those of you who are Googling and want to buy it, please be aware. It comes in two forms. It comes in a bottle that's concentrated and has to be diluted, and you can make like 12 additional bottles after you dilute the concentrate. Please don't buy the concentrate. One bottle will last you forever. So make sure you don't buy the concentrated version. It comes with a measurement cap. And the beauty of this product is, A, it tastes good, and B, it doesn't stain, but it comes also together with a nasal spritz that basically cleans out where the virus enters your system. So you can lavage the nose, you can gargle with it and clean your throat. And wherever I go and in the office and when I travel, I carry this product with me because, again, it can't hurt, but I know it will remove all inflammation in the mouth, but it has the antiviral capability that has been scientifically proven. So we highly recommend this product. And again, we are not endorsing anything, but this product just works.
Thank you. Very helpful and very practical, and everybody can get it. It's easy, and it definitely helps. So if we contracted COVID and we went through the disease process and came out on top and we are getting better, when do we go back to society? Because you'll be positive in a PCR test for some time, even up to 2 to 3 weeks. And naturally, things have changed. The economy opened up. There are so many different considerations, somewhat political and also business-wise, when people can go back to normal life. And I just want to focus mostly on common sense. Number one criteria is you got no symptoms. If you have symptoms, and it doesn't have to be COVID. If you have symptoms, it's just not, socially acceptable to be in society. If you're coughing, if you're sneezing, if you have fever, you look like a mess, you should stay at home. And yeah, there will be some ramifications. There'll be some side effects of staying at home. I realize that. But currently, with what the world has been going through, it would be key to stay home until the symptoms are fully gone. And when you go back to society, wear a well-fitted mask for, at least in my recommendation, at least 2 weeks, minimum of 10 days. You don't have to, according to the recommendation, you don't have to test yourself in PCR. You don't have to. For me, I probably would have done that. I probably would have tested myself just to confirm. But do the right thing. Isolate yourself, quarantine yourself if you have symptoms, but when you go back, wear a mask. Ari, anything to add on that topic?
I think common sense, no symptoms. You want to protect your loved ones. You want to protect your friends, as well as, even when you have a cold, it's not socially acceptable to run around with symptoms and potentially infect other people. So, Ziv, I think we have some slides to share what the official guidelines are from the CDC.
Yeah.
It started out with at least 2 weeks. Then I think because of the economy, it was reduced. So you can review what the official CDC version is.
Yeah, I mean, I don't want to confuse. It's actually very confusing if you go on the CDC website. It's kind of confusing, and it's almost like a very complex algorithm. And in my assessment, when something is so complex, nobody's going to read that. Nobody's going to pay attention to that. That's why we wanted to focus on the common sense, the lack of symptoms. And when you go back to society, protect others by wearing a well-fitted mask. And if you want to have a bit more help about the dates, on the CDC website, there is a quarantine and isolation calculator. You basically punch in when you develop the symptoms, when you tested positive, and it'll spit out when you can go back to society. I just tested it out here. And it's just another tool beyond common sense to tell you when to go back.
Sorry, Ziv, before we go into the next subject, I would also say that we appreciate the great attitude of all our patients. Again, COVID is not over, and that's why we appreciate the great attitude of our patients that on the phone, on the computer, and lastly in writing when patients are coming to see us, we still are doing all the universal precaution and asking you questions in regard of symptoms, in regard of where you have been in travel or if you've been exposed. And we appreciate your great attitude that you take the few seconds either on the phone to fill out this form or do it in the office. And again, we are doing it for your benefit, for the benefit of all of our patients, in order to protect the clean environment in the office.
Thank you. Very important and very helpful. How about travel? Any guidelines? Are your travel? I didn't travel in almost 2.5 years. I didn't leave the country, only virtually. as a seasoned traveler since I've known you, but also during the pandemic, mostly in the past year and a half, what's your advice about travel?
Certainly, the first year, everybody, including myself and my family, were holed up, and we just rented full protection into the office and didn't travel. But everybody who knows me over the last 40 years, I love to travel, and we do have friends and family in Europe and Israel. So, in the last year, I did make trips twice to Israel, once to New York, and recently again to the East Coast. And I basically applied the universal principle to me before the guidelines were changed. I don't understand the official recommendation that you need to have a mask when you travel to the airport. If you take any public transportation, that you need to have a mask in the airport, but then you don't need to have a mask when you're sitting in a closed environment in the plane. So I traveled extensively already last year and this year, and I just apply common sense. And I have an N95 mask going to the airport, in the airport. If it's a few hours flight, as much as I love to have a drink or have some food in the plane, I would rather be protected and for a few hours not eat and drink and be protected in the plane. If it's a longer flight, like to Israel, it's 14 hours. So I do eat and I do watch my environment and make sure that as soon as I finished eating or drinking, I have my mask on. And I apply all universal precaution to it because I want to stay healthy. I want to keep my family healthy. And I don't agree about certain official versions that masks are not necessary because, as we saw, numbers are going up again. And I feel like I would rather be on the side of caution.
Beautiful. And same goes, I feel, in regards to the hotel. We don't have to reinvent the rules for hotels, for gyms, it's all basically a closed environment where you're stuck in a place where you have no control over who is next to you. So how was your experience in a hotel?
Again, it depends where you are going. If you're going to Israel, Israel is very, very strict in regard of that. Even in hotels, everybody who is serving you, including yourself, have to wear a mask in certain environments, like in the elevators and in public spaces or whatever. And I just don't understand sometimes when I travel to the East Coast recently and traveled, and again, without any prejudice, I arrived in Miami in South Beach. And I didn't feel bad, but I did feel weird that I and my wife were the only one wearing masks. Apparently, their masking is not prohibited, but not in vogue. And I kind of laughed about it, and it didn't make me feel bad that I was one of the few people in the hotels wearing masks. Again, good luck to them, and I don't make any judgment, but just because they are not wearing it, I, in the indoor, still prefer to have masks and want to protect myself. So it's kind of interesting depending where you're traveling.
That's great, Ari. We're talking so much about the COVID virus and how to protect ourselves and vaccination and boosters and all these precautions and common sense. We have to remember that the oral environment is really the first port of entry into the body. So in our mouth, we have different types of pathogens. We have bacteria, we have viruses, we have fungus, and they all live like one big happy family until something invades and disturbs the homeostasis. And we can't forget that we also have different bacteria that cause infections in the mouth. Not COVID, it's mostly bacteria. We have also viruses like HPV, like the herpes virus. They infect the oral cavity and invade the body. We've been doing for many years various tests of our patients. They're called saliva tests or DNA tests that test the different pathogens that can be in the body that are statistically associated with things like cardiovascular disease, joint problems, dementia, Alzheimer's, metabolic conditions, pregnancy outcomes, all related to the health in the mouth, and even some say cancer. I'm not saying cause and effect, but these conditions are associated with your oral health. So we encourage you, as much as we encourage you to protect yourself and boost yourself with vitamins and hopefully vaccinate yourself. Also keep your mouth clean. The cleaner your mouth, the less inflammation, the less those pathogens can invade your system. So thank you all for watching. We're going to take some questions right now. We already have some questions here inside the chat, and I'm going to start with a question from Samantha. Hi Samantha, great to have you here on this webinar. Is Mask C named Mask C or C? Okay, so Mask C is just the brand name. Mask in the letter C. I think it would look great on you because I know you personally for many years. A very stylish mask, so it's well fitted. Should I get tested after flying if I wear a mask? That's a great question. Should I get tested if I wear a mask? We used to do it at the beginning of the pandemic. If you recall, if you're a patient of ours and you flew from out of town, we would either ask you not to come to the office the first 2 weeks or get tested. We no longer require that. Ari, what's your answer for testing following a flight? Is there a logic in doing that?
I think for the general public, there is no benefit or logic. It applies the same principle to watch for symptoms and so on. But it's kind of interesting that when we go on an aeroplane, we need to have a PCR test to confirm that we don't have any COVID. When we arrive at the destination, nobody checks us. And we don't know if we contacted the virus. Interesting enough, just because I'm traveling a lot to Israel, and Israel is a very small country, and so Israel is one of the exceptions that actually when you arrive, even so you needed to have a PCR test, you are obligated to take another PCR test at the airport, quarantine. It used to be 2 days, 3 days. Now they have a better facility, and they basically within 12 hours let you know that you are having a negative test and you can go ahead and face the public. So I think dependent, if we are sitting next to a coughing, sneezing person, maybe there is a benefit if you are not isolating yourself after flying and you are facing an indoor environment with a lot of colleagues. That would assure you and give you the peace of mind. But is it really necessary on every time you're flying? I don't think so, because you're going to watch yourself for symptoms.
Thank you, Ari. That's a great answer. Another question here from Samantha is: can we use the IO rinse or the nasal spray for a 14-month-old baby? Because when I arrive, Samantha is traveling to New York, visit her son. I will be with my 14-month-old granddaughter who is not vaccinated, and that's a great question. And Samantha, I'm going to give you my opinion. First of all, the IO rinse and the spray, to my knowledge, is not approved for kids. That's number one. To my knowledge, and I'd like to hear Ari's opinion as well. So we have to be very careful with medications and rinses and sprays we utilize on newborns. Second, the kids that age, basically toddlers, will not tolerate. They don't know how to rinse. They don't know the meaning of swishing and rinsing and spitting out. They're more likely to swallow it, which is dangerous. And lastly, the spray in the nose. As you probably know, the spray in the nose will go through the back nasal passages and go into the throat. So babies don't breathe very well through their nose to begin with. I got 4 of them, so I know. So I wouldn't recommend it. But to give you just a peace of mind, the babies and the kids, they are not as prone to develop severe disease. So yes, if you're flying from LA to New York, hopefully I know you will very well protected during your trip, and definitely on the plane. Yeah, you just want to be careful. Ari, how would you respond to that? Samantha is traveling to New York to visit her granddaughter, 14 months old. What do you think about using those products for babies, and also how can we protect the baby that is obviously not vaccinated?
I think it's a very interesting question, but I agree with you that it hasn't been established that we can use it, I think, under the age of 5 or 6. And I think the same as you said, you will have trouble convincing a baby to gargle and not to choke on whatever goes up their nose and going down their throat or whatever. So unfortunately, there is not one particular point that you can protect the baby besides knowing that, fortunately, the incidence of COVID in babies at this age is very minimal. And I think the only thing that I would say is the more you protect yourself not infecting the baby, the better it is for the baby. So I think your priority should be is to protect yourself.
Great. A question here from Howard. How long does the second vaccine last?
If I may say that, all science points that everybody is different, but in general, it's being assumed that the antibodies are waning dramatically after 6 months. On some people, they stay a little bit longer. We know that by the 3rd or 4 months, it's beginning to wane, but it has been generally established for the people who fall under the group of either over 50 or 60 immunosuppressed, that the goalpost is 6 to 7 months after the last booster.
Thank you. A comment here from Esther. Japan tests you upon arrival, very strict. And that's great because they probably know what they're doing, because people there have been wearing masks for decades. A question here from Francine. If I am in an indoor crowded school auditorium and I'm masked, most people won't be, which is true. Am I protected, or am I better off not being in that situation? Thank you so much for all that you are doing. Much appreciated, Francine. So what's the answer to that?
I think that, best is not to be there. But again, we want to have a life. We want to participate on activities of our children. And I think if you are wearing a well-fitted N95 mask that may be uncomfortable to wear for 6 hours or 7 hours, but for an hour or two of an activity in an indoor environment, you should be 99% protected. There is never 100% protection, but that would be my common sense, and I would feel very comfortable being in an environment where most people are not masked, but I'm masked with a well-fitted N95 mask.
Great. And maybe Francine, maybe sit next to a window, sit by the door. If what's happening in that auditorium is worth being there, then I feel like we're at the point in the pandemic that we know how to protect ourselves. And a well-fitted mask and maybe some eye protection, I feel like is a great thing to have. Okay. Here is a comment or a question from Steve. If I had COVID in early January and booster in mid-October, should I get the second booster now or wait so that it can be the best impact a potential trip out of town for the 4th of July? I've heard the second booster loses its effectiveness after 4 weeks. So, Steve, this is a great question, very detailed, and maybe Ari, you followed exactly, but I just want to repeat what we said before, and maybe that's where the answer lies. If you had COVID in the past 3 months don't get boosted. So I don't think that applies to you. Ari, do you think there is any, can we finagle, or can we figure out the smartest timing to get a vaccine? Let's say if Steve is planning to travel 4th of July, would you recommend, within the precautions of, we're not physicians, we're not telling you when to take the vaccine, would you time it closer to the trip, within a week or two, or it doesn't actually matter?
I think in the big picture, if it's after the last vaccination, it's 6 months or 7 months, yes, you can play it a little bit and say let's not do it 6 months later, but 7 months later, because it's a couple of weeks before the trip and I will have a higher antibody reaction. I think you can play around with the weeks. I will give you my personal experience is that I plan to travel to Israel soon, and I travel to Europe at the end of the summer again. And I was thinking, like, I was vaccinated around October. It's about 6 months now. Maybe I should wait and push it, and maybe the new vaccine with a new variant will be there. But once it became clear to me that the new, stronger, better with variant application vaccine will not be available until the fall, I didn't want to take the risk of being for another 4 or 5 months without any booster. So therefore, I just stuck to the line of 6 months after the last booster. And 6 months from now, we'll see what's available or what's necessary for the fall.
Thank you. By the way, for the patients asking us, guys, you're talking to us about precautions, but here you're sitting one next to each other, two doctors, and you're not masked, and you're not practicing what you preach. The answer to that is we're actually in a virtual studio. In case you didn't notice, we're still in our office, but we're in separate rooms. And we have this great technology where we have a broadcasting specialist that puts us together from different rooms and puts us inside this great studio with the background of LA, live, those live movement behind us. Okay, we have a few more questions. By the way, Ari, before I'm going to look for those questions, is there something you'd like to share with us, that nobody actually knows about you, and very few know about you?
I think most of my patients over the last 40 years know most of my life outside of the office because I gladly share it. But for those who don't know it, I've been practicing now for 42 years, and I plan to do it much longer because I'm very fortunate to have a great partner like Ziv, who makes it possible for me to leave and come back to a functioning office. So some or most of you know that one of my passion, together with my wife, is collecting contemporary art in Israel. We are very committed to the state of Israel. Our parents are Holocaust survivors, and some people support the state by buying trees or donating money. We feel like we are supporting Israel by supporting their starving, very promising artists. Our life centers a lot around the art. If we are not traveling, we are visiting art fairs like recently LA Freeze. We actually established 7 years ago a prize in Israel in order to give back something to society. And to your right, you can see it's the Ann and Ari Rosenblatt Prize for Visual Art, where once a year we are giving a certain sum and scholarship to artists who are deserving with certain criteria. And that's why we are traveling lots to Israel to reconnect with family and friends and supporting the arts. And when we are here in LA, everybody knows my passion of running marathons, but we love and breathe our family life and our two grandchildren, including Larry, our family dog, and spend a lot of time with family. So we are very, very fortunate, and we are very, very blessed. We travel, and again, thanks to Ziv, we can travel to far away and come back to a well-functioning office. So I can only say, when people ask me now during COVID, how are you? We are very blessed, including you, our patients, that we are not surrounding by rockets, we are not surrounded by famine, and we are just blessed. And hopefully, I will be, because of my hobbies and travel and having a great family, I'll continue working for those people who don't see me in the office. I have not retired, I will not retire. But Ziv allows me once in a while to flee out of the office after 42 years, have a little bit of fun, and return to the office. So I'm looking forward to see all of you on a continuous basis for a long time.
Great, Ari. Thank you for sharing all of that. And what's important is travel in safety and enjoy. And we always love being together here with you. But I understand that after 40 years, you want to explore the world as well. A couple more questions.
Everybody wants to know, I do test myself with a PCR test when I return for my own well-being and for the protection of the office and our patients.
Great. Plus, we keep the precautions in the office. So a very good comment here from James. An infectious disease doctor I know says that you should wait 3 to 4 days following flying to test for COVID, because even if you were infected during the flight, the disease won't have incubated sufficiently to test positive immediately after flying, and that's totally correct. But we still do rapid tests, and we still test after 4 to 5 days as well. So that's a very good comment. Well taken. Question from Adam. How about outdoor while wearing N95 masks, assuming most people won't be masked? High school graduating coming up, outdoors. Outdoors, you don't have to wear masks anymore. It took me, a few weeks to really take off my mask walking in Beverly Hills and walking to the bank, which I do, a few times a week. And it was hard, but I'm not going to go into the bank or go into a retail store unmasked. I just won't do it because I don't see the downside of wearing a mask. But outdoor, you don't have to wear a mask. If you're congregating with a lot of people in your face and you're having drinks or eating outdoors with people that you don't know and untested, well, you have to make your own decisions. A question from Francine. Is a well-fitted KN95 mask as protective as N95? Well, it's to be determined, but in our experience, the KN95 is very well suited for civilian life. As a doctor, you're better off using an N95. We use the KN95 because you can get N95s. The situation is different now as we are over 2 years into the pandemic. A comment from Howard. We were just in Paris last week. Great for you. Masks are required on Air France. My wife is a travel professional who is also a patient. And that's correct. Susan, thank you for your comments. Thank you so much for the incredible information with much appreciation. A question from Catherine. What is the difference between K95 and N95? Well, technically, they both are 95% protective of the viral infection of COVID. The N95, to me, for lack of a better term, is just more legit. K95 is mostly manufactured in the Far East, in China and other places. We don't have much control over that. No offense. I would prefer N95. That's for me. But K95, again, to be out and about and to live a normal pandemic life is quite enough. Comment from Barbara. Thank you for this incredible information. Always learn so much. Comment from Esther. What an amazing endeavor to support local artists. Ari, this is for you. And what a wonderful family. I'm so grateful for your seminar. I kept sharing what I've learned to my family and friends in Hungary. After rewarding your advice to them, my doctor friend's family took increased dose of NAC upon getting COVID, and their symptoms went away much faster. That's great to hear that. Ari, you listen to this. It's incredible, the impact. A comment from Catherine. Thank you. You answered my question. Yeah. Thank you all for attending this. Ari,
If I may, if I
yeah,
may
go ahead.
just add something, I want to give a compliment to you for encouraging the whole office and taking this project of renovating, enlarging. You did an amazing job, and it makes me proud and motivated to continue working in this environment. But since everybody is asking a question, I need to ask you a question. I do know that when I come to the office and when I leave the office, you're always there. I think you're working 24 hours. Please share, at least with our patients, to get to know you. What are you doing on the 25th hour?
Great question. Well, most patients know that I have a pretty big family. I got a wife. I got 4 kids, ages 16 to 6, 2 in the middle, and we have pets. So I wanted to share a photo of my pets. We now, beyond the dog, we now have 2 cats. One is called Prince Theodore, the white cat. They actually both are kittens. And the other one, his name is currently Remy or Rocky. We're not clear. He's new to our family. We're not sure which name to pick. And yeah, I became a cat lover. And here's just a quick photo of my daughter and my son helping her to loosen up a baby tooth, and maybe it's the next step of being a periodontist. I don't know. We'll find out in a few years. Well, thank you so much all for attending this webinar. We hope we created value for you. I hope this was simple, clear, and concise. Hopefully your questions were answered. Hopefully you can go back to living a normal pandemic life with certain precautions and utilizing the tips and the different pieces of information we shared with you today. It's important to live a normal life. Don't live in fear. Don't stay home out of fear. There's great things that you can do outdoors using your common sense. Ari, thank you so much for being my partner for 20 years and pushing hard and helping me and the whole team expand and remodel the office, because what doesn't grow dies. And I think it's pretty obvious we need to keep growing. So thank you, everybody. Have a good night and stay safe. Take care.
Stay healthy, stay safe. Bye-bye.